got some anterior elbow pain specifically with supination. And so using P-DTR, we're going to assess the function at the elbow where the pain is. So I'm going to test the short head of the biceps and find that they're hypertonic. I'm going to test the triceps, which are also hypertonic. And then I'm going to test supination, which is the most provocative test. Strong. Hold again, please. And hypertonic. I find that nothing around the elbow resolves this problem, but if I rub over the wrist, hold, then the supinator inhibits. If I rub over the wrist, then the short head of the biceps inhibits. And if I rub over the wrist, the triceps also inhibits. So we know with P-DTR that the problem causing the dysfunction in the elbow, the hypertonicity of all the elbow musculature, and thus the symptoms of the elbow, that problem is actually coming from a sensory issue in the wrist. Now, we're going to have Dr. Dukes, Dr. Justin Dukes, who is a chiropractor, he's going to do an adjustment on the radial head, and we're going to see what happens. Go. So this is Dr. Dukes doing a radial head adjustment. Okay. And then we're going to go ahead and immediately go ahead and sit up. We're going to retest and we're going to see what happened from doing this adjustment. Okay. We're going to test the areas that were problematic. Hold strong. And sure enough, the hypertonicity is gone. These muscles now hold strong in the clear, hold, and properly inhibit. And this patient would be sent on his way probably feeling better until the problem that we know to be software-based, a sensory problem coming from the wrist, were to be stimulated during the course of day-to-day activity, and then immediately, hold, the hypertonicity has returned. So he felt better for a while, and then because the problem was located in the wrist, not actually in the radial head, it had the ability to recreate these problems and thus probably recreate the symptoms. So using P-DTR, we've done an assessment and know that this problem is a problem in the wrist and in the interosseous membrane between the radius and ulna. So we're going to fix that and find now, hold, that once again the problem is resolved, and now when he goes out and in day-to-day activity puts stress through the wrist, hold, the problem doesn't come back, the elbow muscles continue to inhibit properly.